Hi everyone, Dr. Cindy here from drcindycorp.com, and today I wanted to talk to you about why it's so important to get regular eye exams. Now, one of the questions I get quite a lot, whether it's from my patients or my relatives, friends, people I meet, is why do we have to get eye exams so often? I mean, if I can see well and I don't have a problem, why do I need to go? Or, well, my prescription hasn't changed in many, many years, so why do I have to keep coming back? Well, I want you to think about it. The eye isn't only about seeing. I mean, that is its major function, and when we think about the eye, that is what we think about, is sight. So we want to make sure that we preserve that sight, don't we? So, if you recall in a prior video that I've done, the eye is only about 1 inch in diameter, about 2.5 centimeters. And all your blood vessels run through the eye. Now, if you think about it, compared to all the other organs in your body, if the blood vessels that run through here are going to be much, much smaller, much more delicate. So that means if there are any issues that are affecting the rest of your body or any other specific organ in your body, remember the body is interconnected. So nothing happens just in one part of your body without it having a reaction somewhere else. So anything that's occurring anywhere else in the body, if it's affecting your blood vessels in any way, trust me, they're going to be affecting the blood vessels in this small space to a much higher degree. So things such as diabetes or high blood pressure can cause quite a bit of damage to the eye before you even start noticing any symptoms yourself. Lots of times people actually get diagnosed with some of these things simply because they've gone for an eye exam and the doctor has picked that up. Now, yes, it is important if you can see really well, that's all well and good, but there are different parts of the eye that have to do with sight, and we want to check and make sure that those are healthy. There also are some serious eye diseases that are silent and that can actually steal your sight without you even knowing until it's too late. Things like glaucoma. Glaucoma is a disease where the pressure inside your eye causes damage to your optic nerve. The optic nerve is the part of the eye that goes to the brain. Once the nerve becomes damaged, you start losing your side vision or your peripheral vision. And you really don't know because it's so insidious. It's nothing where you feel pain, anything like that, but you'll gradually lose your side vision until it's significant enough that now you start noticing the problem. And the issue with that is that once you've lost sight, you cannot get it back. So this is why it's very important to make sure that you get very regular eye exams, just to check the health of your eye and make sure that everything's in good working order. I mean, let's think about it. You go to the doctor ever so often just for a checkup. You take your car into the mechanic to maintain it. Why would you not check your eye, which is something that you use every single day from the minute you wake up in the morning to the moment you go to bed and close your eyes? So, especially for those of you who wear contact lenses. Now that's a whole nother story in itself. People who wear contact lenses, I get this a lot. Why do I need to have an eye exam every year? My prescription hasn't changed in 20 years. Well, contact lenses are medical devices. They're classified by the FDA as a medical device. And they can cause damage to your eye if they are not fitting you correctly or you're not taking care of them properly. And you know, some of you out there do not take your contact lenses out on a regular basis. You do not replace them on a regular basis, and you don't clean them properly. So, you can cause serious damage to your eye, again, without any knowledge at all, because there's not necessarily any pain involved. Once you start wearing contact lenses, those contact lenses actually decrease the sensitivity to the front surface of your eye. So you could have an infection or have scarring occurring to the front part of your eye and not really know it until the damage has far along gone. So please, Go and get an eye exam. Don't complain when the doctor says that they need to dilate your eyes. Yes, it is a little bit of an inconvenience for you. Everything's going to be a little bit blurry for a few hours afterwards. You are going to be very sensitive to the light afterwards. But that's really the only way that we can get a very good look at the structures behind the eye, to look at the blood vessels, the optic nerve, the tissue, the retinal tissue that acts like the film for your eye. It's important. And my suggestion would be that if you have very good vision and you're very healthy, once every 2 years would be sufficient. If you do have some kind of chronic problem like high blood pressure or diabetes, then you need to have a dilated exam every year. And yes, you contact lens wearers, you need to have an eye exam every year just to make sure that everything's fitting normally. And we'll talk about that probably in another video, because as I said, we could talk about that for ages. Anyway, thanks for tuning in, and I'll see you again soon. Have a great day.